The first presumed positive case of coronavirus was confirmed in Pennsylvania earlier today. Governor Wolf made an announcement this morning.
An emergency response team here in Pennsylvania, right here in this building, has been working diligently to develop a plan for when this virus inevitably arrived in Pennsylvania.
2 Pennsylvania residents were identified with the virus, one in Delaware County and the other in Wayne County. One resident recently traveled to a country where the virus is present. The other traveled to an area in the United States where COVID-19 was identified. Both are quarantined at their homes. 5 schools in Bucks County with ties to one of the patients were closed today over concerns of the virus spreading. Health officials urge everyone to wash their hands for 20 seconds and to stay home if you feel sick.
Now, many in our area concerned about what to do if the coronavirus makes its way to central PA. Today, our reporters are out gathering information on how the coronavirus is impacting our area. Our Colleen Knutson talked with senior centers about how they're preparing, but first our Evan Hinckley's asking how emergency responders and local hospitals are getting ready for the virus. Evan, tell us more about what they're saying.
Hey, good evening, John and Amanda. Folks we spoke with say it's not a matter of if, but when the coronavirus will come here to central Pennsylvania, as many local EMS and local hospitals, especially smaller hospitals, say that preparing for the virus presents its own set of challenges. However, those we spoke with today say that they're as prepared as they can be. Hospitals throughout our region are getting ready to handle coronavirus cases.
Well, we're close to the Interstate 99, and we also have Greer School in our area, and we're, State College is not that far away either. So we have to be ready and we have to be prepared to accept a patient from anywhere.
Those at the hospital tell us they're equipped to handle coronavirus patients, just a limited number of them.
We would only be able to accommodate 6 patients.
With 6 rooms available right now for quarantine. There's no widespread medication on the market for the virus just yet, but we're told both small town and larger hospitals would have a limited supply in the future.
Allocation is an issue for our facility. It being a small rural hospital, it would be limited.
Local EMS crews are prepared as well.
We don't wait until the first case is confirmed. We do good practices every day prior to that confirmation, because if you wait until it's actually confirmed and known to be present in the community, then you're behind the game.
Bellefonte EMS Executive Director Scott Rote says they've seen calls with flu-like symptoms.
People with fever and shortness of breath and general illness, that's potential.
That's why they're putting a big emphasis on cleaning before and after calls and reminding crews the best ways to handle patients so the virus doesn't spread.
We routinely carry normal personal protective equipment, whether it be eye protection, goggles or face shield.
All are used on calls with potential symptoms of the coronavirus, a disease state officials say is not going away.
We expect more cases to be confirmed in the upcoming days and weeks.
And state emergency management services will be allocated about $25 million to help take over efforts to combat the virus. Now, what does that mean for local counties? Well, now each set of county commissioners will have the power to vote if they want to place their own county in a state of emergency, and they'll be able to pull from state funds and their own county funds to do that. Reporting live here in Center County, Evan Hinckley, WTAJ News.
Thanks, Evan. And the population most at risk of contracting the coronavirus is the elderly, many who have weakened immune systems.
Our Colleen Knutson joins us now to explain how local retirement homes are responding to the threat of the virus spreading to their residents. Colleen, what did they say to you today?
Amanda, John, many of the nursing homes and retirement communities in the area were already warning visitors, employees, and residents about the flu. Now with the coronavirus, their strategy to keep folks healthy and safe is focusing on prevention. On Friday morning at Garvey Manor in Hollidaysburg, infection preventionist Laura Bankert put up a new health notice.
We definitely want our residents to feel like they're in the safest place that they could possibly be as far as getting sick.
But Administrator Sister Joachim says the announcement of confirmed cases of the virus in PA doesn't change their procedures.
The fact that there's 2 cases in the state really doesn't make it any different than what we've been doing right along. because infection control is part of our culture.
Because of flu seasons, employees and visitors were told to stay home if they showed any symptoms like fever or cough and practice healthy hand washing habits.
You need to make sure you're covering all surfaces of the hands, under the nails, in between your fingers, and up to your wrists to ensure that you're making sure you kill as much virus or bacteria as possible.
Despite the expanding number of cases, residents at the manor aren't panicking.
They have not voiced any concerns of anxiety that we're not doing something to protect them.
And one more tip for folks out there, those masks that you see a lot of health officials wearing, that is to prevent them from spreading any germs to the patients that they're caring for. It will not prevent you from catching the coronavirus. The best way that you can stay healthy, they say, is washing your hands and just following healthy habits and also staying up to date with what the CDC has to say about the virus. In Hollidaysburg, I'm Colleen Knudsen, WTAJ News.